Hello everyone, welcome to my channel. My name is Dr. Shiva Aslanpour, and today we are going through some exercises that is beneficial for office workers with sciatica pain.
Okay, let's go.
Before we start, I would like to explain what is sciatica pain and what are the main factors that you should consider to improve this type of pain. Sciatica pain is a nervy pain that is getting referred down toward one of the lower extremities. Most of the time, the nerve is getting impinged by disc herniation or disc bulging, but sometimes the impingement is from the muscles that are tight in hip area. And the main muscle that is getting involved in this problem is piriformis muscle, that is located deep in pelvic floor area, and its tension can cause problem for you. With sciatica pain, you might feel numbness, tingling, or shooting pain in your lower extremity. Sometimes you might feel that your back or your leg is getting heavy. It depends how bad or how severe is the condition. It is one of those conditions that can come and go on and off, so it's better to take care of it before it gets problematic. What should be considered is improving mobility of the lumbar spine and hip joint, improving mobility of the sciatic nerve, and also strengthening some muscles. If there is tension, if there is tightness, we should release that. We should take care of the inflammation and severity of the pain. It's important to have a plan. And the main thing is avoid aggravating your pain. So if there is a function or if there is a position that increases your pain, it's better to stay out of it and do other things, because we want to stay active, but we don't want to aggravate the pain. The first exercise that you can practice behind your desk is sciatic nerve floss. For this exercise, you sit on your chair, your feet should be on the floor, you cross your arms over your chest and bend forward. You try to curve your back as much as you can. As you see, I'm bending from here. It's not from my lower back. So I'm trying to curve it from my thoracic. I go down as far as I can. And in this position, I bring my knee up as high as I can and start moving my ankle to mobilize my nerve from the bottom. Another way to do this exercise is holding this position and looking up and down. You also can extend your back and go down. And also you can move both leg and torso at the same time. I just want you to remember, for some people, even bending forward can trigger the pain. So if you feel that's your limit and you bend forward, you are about to feel the shooting pain on your leg, I want you to stay in that position and do not go further. So you just hold it and slowly try to pulse in that range. I have had patients, they couldn't raise their leg at all because of the severity of the pain. So if that's your case, you can put your foot a little bit ahead of you and try to dorsiflex and plantar flex your ankle. You try to move your ankle up and down, really gentle, at the level that it's not triggering your pain, at the level that is tolerable for you. The whole point of this type of exercises is staying active and lowering the inflammation, improving the mobility of the nerve through your lower extremity. So you don't want to push through the pain, because when you get used to having pain, your brain will accept it as a norm, and that will be really hard to treat. That's the problem with all chronic pain. So we don't want to go there. We want to take care of the pain before it's too late. Another thing you can try on your desk to improve your sciatic pain is releasing your painful muscles by using a tennis ball. You can use tennis ball, lacrosse ball, any ball that is in this size. You put it under your butt. You try to find the painfulest area. For some people, even their hamstring could be a good spot to put the ball. So you just locate it in a spot that is painful. You try to find it, and just be careful that the amount of pressure that you're putting over the ball should be manageable. So don't put too much weight because it can aggravate your pain. Nerve pain is really hard to manage. So it is so important to avoid aggravating the pain at the first level. Find a painful spot and you try to press yourself over it, going back and forth. And also you can do a little bit marching as much as you can, and it's not triggering your pain. You can do 20 of this. You can put the ball under your hamstring area because that's the direction your sciatic nerve goes down toward your knee, and start bending, extending your knee to release the muscle around that area, and it will help with your pain too. Another exercise that you can try is stretching your piriformis muscle. This time you can try using tennis ball also. So you put the ball under your butt area and bring the leg up and try to push your knee down, hold it. You can bend forward. Don't forget to breathe. And you can play with your knee. You can go up and down. Being still will increase the inflammation in your joint, and you are going to feel more stiff, more painful, and your symptom might get aggravated by the end of the day. That's why I made this video, to help you get some idea about how you can manage your pain while working. So one thing you can do is take a break, do these exercises that I'm giving you. It's good to have an active break. So these exercises I'm showing you, you can practice behind the desk. I hope you enjoyed it. Don't forget to subscribe in my channel. I see you next time.